Hey, Miss Keisha.
Hey.
So we got more questions for you.
All right.
Let's go.
Get it. Let's get it. All right.
All right. So we have questions about a common topic that has come up a lot, and we want to address this: understanding the narcissist.
What a fun topic.
Oh, the funnest topic.
Fun topic. All right. Let's get it.
So, the first question is, how can I tell if someone is truly a narcissist or just has narcissistic traits?
That is a good question. So, first and foremost, let me first say, we got to stop labeling people. Because we all have a trait of something, right? And a person can very well have those traits, though, right? But you really don't know if they are until they're diagnosed. And I say that because this is a real life diagnosis, like for real. When you have people hear the term personality disorder, the first thing they go to is, no, I don't have multiple personalities. It gets confused with that. We're not talking about dissociative identity disorder, which is DID, known as multiple personality. When someone says that you have a personality disorder, what they are saying is, this is who you are. The reality is they don't change. This is part of their personality. So there are a few diagnoses under that scope of personality, DID being one of them, also known as multiple personality. Another is borderline personality disorder, antisocial personality disorder, narcissistic personality disorder, and that is just to name a few. You got histrionic and so forth. So to know, they need to be diagnosed. And I'm not going to say that you can't diagnose them. I'm just going to say if you're dealing with a true narcissist, they may not go to get diagnosed, right? Because, oh, why would I, right?
Right.
So how to tell is that just the traits, but until they go see somebody like a therapist like myself, psychiatrist can, a psychologist can, or like I said, a therapist, to have the official evaluation, tagging them to say that's exactly what they have, you really can't do, but you can see all the traits. The other thing with that too is because they're so good at what they do, it may take a couple of sessions before you see it. But if it's really bad, it's going to show up front and center.
Oh, man.
Yes.
So, like, what are a few of the traits that you would see in somebody who is narcissistic?
You ready for this?
Yes.
Because they show up in our everyday lives. And I'm not saying women can't be, because I've seen it. Oh my gosh. I notice it more in men. So I don't really know what the statistics are versus like which gender it's more prevalent in. I will say I've seen it more so in men. They are very domineering. They feel like they are. It's the difference between having confidence and really being critical of others.
Right.
So they see themselves, they can't do no wrong. They're never wrong. Everybody else is wrong, and this is why. They won't say people are beneath them, but they're very hypercritical of people. Here's an example. I used to see someone, and he would make statements like, such and such over here, and we go to a cookout, but he's bringing stuff from Sam's Club because he works there. Like, I bring lobster and steak. And I'm like, how harsh is that? Like, how dare you? You know, but I'm saying this in my mind, but this is a trait of narcissism. They're so important. They will really be hyper focused on what they do. I do this for the community. I do this for people. I've done that. Kind of so much to where the next person may be, why is that so important to you for people to know what you've done and how you've done it? And it may not have anything to do with what's going on at the time. They have to be the center of attention, and they're always right. They will gaslight you real quick, because guess what? They're never the problem. Everybody else is. Or the reason why I did this is because you did this. They deflect big time. They are just preoccupied with feeling superior to others, you know, and putting others down and criticizing others, and manipulation is key. They will have you believing, depending on what type of relationship you're in, you be like, is it me? Was it me? No, it's them.
Sounds like a few
them.
exes I know.
Yes. that I'm not missing anything. But they also run from hard situations. Conversations, when you start to have these conversations with them, they deflect, they retreat, and get offended. They really get offended. They are highly arrogant people. I hear oftentimes women say, oh, he was narcissistic because he cheated on me. That does not make a narcissist. There's other things. Because he gaslit you does not make him a narcissist. And I hear that often. We have to stop labeling people. Are these traits that people can have? Absolutely. But we probably got one or two too.
Right.
You know?
And as long as you're not showing all the signs, like you said, we don't know if they're a true narcissist or not.
Absolutely, because one thing about what we do, and people will go around and just throwing out things because they think of what it is. There is truly a system to diagnosing. There's a whole system, and you have to look at onset, duration, frequency, and they have to meet a criteria of having certain symptoms and how many of those symptoms that are present at a time. Nobody is good at holding the mask too long. It eventually comes off. So even if they go to therapy and they hold that, within 30 days, you'll usually see it. We call it the honeymoon phase. But somebody that's really, really narcissist, oh my gosh. Like, and I don't like to speak ill of the dead, and that's not what I'm doing. But just if people heard about the person that was on social media before his passing, Kevin Samuels. Oh, baby, narcissist. Oh, yes. You know, so you see them, and they're also in women, and people struggle with a narcissist, whether it's their parent, their child, an intimate partner, a boss. They're out there.
That all good answers. Look, trust me, I'm taking notes too. So question number 2.
Okay.
What are the most common manipulation tactics that narcissists use?
Oh, all of them. They pull out all the stops, baby. All of it. But like I mentioned, gaslighting, deflection, making it, they turn it around, always finding the wrong in the situation as long as it's not them. And make it to a point to where if you don't know what you're dealing with or you haven't dealt with them long enough, you would think like, no, it really is somebody until you see a pattern. We have to recognize the patterns and the patterns of manipulation. There's something wrong when the problem is everybody else but never you. You throw a rock and you hide your hand, or you throw it at a glass house. There's something wrong with a person that never wants to take accountability or responsibility. And then if they do, they take it, but there's always a but and a diversion somewhere to make it that I did because of you. It was you.
Woo, chills. Because I can relate. So I was like, chills, literally.
Yeah.
And I'm pretty sure a lot of our viewers out there can relate, because I'm pretty sure everybody has dealt with some kind of narcissism in their life.
Absolutely. You know, I wouldn't have went off on you if you hadn't have done this. If you would have just stood by my side and stood there by me and had my back. Now, there are situations where that's warranted, but with the narcissist, it's always going to be that way. It's because of you that this happened. It ain't because of me, because you know me.
I know some of y'all viewers are watching this, like, rolling your eyes, looking at people right now, like, I know I'm sitting next to one now.
Yeah. At least you got the trait. You need to go get diagnosed real quick. Yeah.
We're going to take you to therapy.
That part.
So.
They may not go now. They may not go. You know why? Because ain't nothing wrong with them.
Right. They don't want to claim anything's wrong with them.
No, I don't need help. Ain't nothing wrong with me. I'm perfectly okay. I've been this way my whole life. It got me through it. My relationships, no, let me tell you what she did, what he did. It was never me. How do you deal with a person who's never wrong?
You don't.
And they're only wrong in the sight to where it benefits them.
Yeah.
Because then it's flipped. And then the gaslighting happens and the manipulation happens.
Question number 3. Why do narcissists behave the way that they do? Is it conscious or unconscious?
That's a good question. I believe it can be a combination of both. And the reason why I say that is because it's kind of like that question, is it nature versus nurture? I can never say that. Are people born evil? Are they born bad? People have different perspectives on that. I think that people are born innocent, but I do believe that depending on what you believe and how you believe, there can be genetic factors and things in your genealogy that can play a huge part. It can also be molded and created. Just how trauma impacts the body so can your upbringing. That's all part of it, right? Your upbringing, your environment, your parents. If you were raised by narcissistic parents, what is the likelihood that the child is going to be a narcissist as well? You know, could they escape that and be totally different and say something is wrong with my mom or dad? Absolutely. Absolutely. And I do believe that a lot of it is molded in childhood. Could it be trauma based, like something happened? Could be. But a lot of that is shaped throughout childhood. Again, not to put him out there because I don't know this brother. I pray for this brother, I'm gonna be honest. But I see social media cut down Kanye West a lot. There's definitely a personality disorder there, and he has narcissistic traits. Very much so. I can't say he's a narcissist because I haven't diagnosed him or nothing like that. But you can very well have these traits. What happened? What happened along the way to cause this person to be here right now? We only know what we're allowed to see, but you don't know. Could it be that these things develop and they were allowed to say certain things? And now I'm off of Kanye, but I'm just using it in general. Like, was he allowed to have this ego as a kid and say these things? And now it's like a grooming almost, because if we're not checking that behavior when it occurs, especially in childhood, then you're saying it's okay. And it continues to grow. But most personality disorders are known to be weaved from childhood trauma.
So, like, we can't necessarily say that somebody's like born a narcissist. Basically, they're created.
I would say they're created.
Oof.
I am a believer that people can be born evil, but I believe that on the spiritual aspect. I believe that mental health is also spiritual warfare. They can be born, yes. If you come from two bad vessels, and this is ingrained in your DNA, there's a higher likelihood that you will be that way too. Think of it from a perspective like addiction. And I don't want to stray too far off topic, but do you know there's a higher rate of a person becoming a drug addict or have drug dependency or alcohol dependency if at least one of their parents was also in addiction?
Yes.
It's called predisposition. You're predisposed to this. How can you live in a house? Remember the movie Mommy Dearest?
Yes.
Think about, could you live in a house with somebody like that and
No.
come out unscathed? do some of us? Yes. But it still impacts the way we see the world and how we operate in relationships. And at some point in time, we develop these personalities to protect ourselves, whether it's right or whether it's wrong. These things happen. So do they come out of the womb that way? I can't say that. I just can say that biologics, genealogy, and a lot of things play a huge part, and then you throw in the environment. So is it nature or the nurture part? It's both. I don't think you can escape one or the other.
Wow. That's an interesting way to look at it, because like sometimes I see people and I feel they're kind of on the narcissistic path. But then like you'll hear something like, oh, well, I didn't have any issues growing up. And I'm like, so how the heck did you become like that?
Sometimes there's issues present, but if you don't see something else, how do you know it's an issue? If I was placed in a dark house all my life and I never was let outside that house, then what do I know what natural light looks like? How do I know that might hurt my eyes or so? And it's like, if I'm raised in poverty all my life and we have no access to TV or radio, and where I grew up is a impoverished place, all I know is when I get older of things that I hear that is different, but until I experience that, I really don't know that it's different, because what I grew up around is normal. I hear that all the time with people. I ask them about, like, were they exposed to any trauma or violence? And they say, yeah, violence was normal in the neighborhood I grew up in. So when I see it now, people think I'm weird because it doesn't bother me. No, because they were conditioned in those environments. So until I get older to be around something different to show me there is a different way, how do I know? And it goes to that saying, people say, well, when you know better, you do the better. Incorrect. Because you can tell a person, but some people need to be physically taught. So until I'm taught better, I don't know to do better. You telling me doesn't create change, because I may not comprehend that way. Same thing for a narcissist. They have to want the help. Anybody with a personality disorder. Because can these symptoms be alleviated? Yeah, with help. with help and mindfulness and consistency and commitment.
So there is actually help for a narcissist. Like, can you actually, I don't want to necessarily say cure, but can you help a person to be less narcissistic?
Absolutely, because keep in mind it's a personality disorder. Can you not help a person that is borderline personality disorder? Have you ever met somebody that has borderline and people see them later like they've changed so much because they did the work? It may not completely go away and they're going to have bad days like anybody else, but it's not as prevalent as it was before.
Gotcha.
And it may be something in their environment that they've even changed to where it doesn't exacerbate those symptoms, meaning make them worse.
Okay.
So good question.
And the last one is, well, actually, you kind of touched on this, but can narcissists change, or is it better to focus on protecting myself?
Whoo! Good one, baby. Can they? Yes. What is the likelihood? I don't know the statistics on that, but I will tell you this: if you have someone that some of the things that I mentioned that they do, you need to protect yourself because your physical and your mental well-being is at risk depending on who this person is in your life. If it's a boss, maybe start looking at other jobs. And I understand it's tough out here for a lot of people, and a lot of people are because of the climate of our economy and stuff, they're weary of changing. So you got to do what you can to protect your peace, right? If it's a relationship, I had someone, I had to call her. This is not changing. You need to make a decision for you. I'm not telling you to leave because that's your decision. You will never say she told me to leave and then this person changed. No. But you have to know what you're dealing with. See, you can't heal something or deal with something if you don't know what it is.
True.
Once you know what it is up to you also to do the work to do what you can. And I'm a huge advocate in protecting your peace and holistic healing, which means that if it no longer serves you, if it's no longer purposeful in your life, if it is toxic and creating more harm than good, then separate thyself. And I don't care if it's mama, daddy, sister, brother, boss, wife, husband. If it no longer serves you and it's causing more harm than good, then separate thyself. That's whether it's for a short amount of time or indefinitely. Because I don't believe in putting myself in harm's way constantly, over and over again. And hey, to the parents out there, child rearing and raising is not just what you tell them and what you tell them to do, but it's also what they see. That is learned. You're conditioning them. So if you consistently stay in this environment and they see this or they're dealing with this, and bless the hearts of the children to have a parent like this, they're exposed to it. So you're teaching them that this is okay. It does not mean that the child will turn out that way. I'm just saying they're exposed to it every single day and they're sponges. And who knows, it can impact their mental health to now they may not be narcissistic, but they're struggling from PTSD, anxiety, depression, amongst some other things, anger, anything, because they've been impacted.
And I was actually going to say that because I'm pretty sure with dealing with that behavior, it definitely impacts your mental health. So now you're having to go to therapy because you're suffering from X, Y, Z from dealing with this person for so long.
Absolutely. Key word, suffering. I used to hear people say, I'm tired of this. And I used to hear my grandma say, you ain't tired. When you tired, leave. That's my philosophy. When you tired, leave. The only people that are stuck are children, and it's sad. It's sad. If they don't have somebody that can take them in or, whatever the case may be. But as an adult, you have to make the active decision to protect your peace. And when you're willing to do that, and I'm huge on that, I tell people I'm a leaver. Act up if you want to. I'm out. I ain't got time. And I know certain personality disorders because it's like it's something in me. It's like a spidey sense. They can say something, do something. I'll be like, ooh, I'm watching you. Because I know. And it is hard to treat. It is hard in many, many cases to treat because you got to get a person to become more mindful and aware of what they're doing and what's wrong with what they're doing without saying, you're wrong, you're wrong, you're wrong. It's helping them to be mindful and aware of these things and how it has impacted not just their life, but the lives of others around them. And then they want to make an active change. AA, NA, all of those hit it spot on. Until you admit you have a problem, there's no recovery.
I just find that so interesting. And like, one of the things that I wonder is, because this is so severe with personality disorders, are those harder to treat than other like clinical diagnoses like depression and anxiety? Because those aren't as, I guess I want to say, like trauma based or whatever. Like, so when it comes to personality disorders, are like those the most difficult to treat because of how severe they are?
So I would say that would be probably based on the provider. Me personally, I always believe, this is me, right? They can crucify me if they want to. I always believe, especially when it comes to narcissistic and borderline, I wish that there was a certain certification, not to cut providers out from treating it, because you never know who has a gift. I believe that there's a calling in mental health. That's just me.
Right.
I don't believe that you can be textbook and just be out here. I think that it's a gift. We all have gifts, right? But I do believe that there are certain things that may need additional training on to better equip yourself. Because I will tell you, when it comes to certain personality disorders, it can be very triggering. We have terms in our field called like countertransference or transference, those type of things. That means, put it like this, we live in a world where you can see a person or they do something, and no matter how peaceful you are, they can trigger you. And you like, oh, nope, I can't deal with you. It makes me uncomfortable. Providers are no different. People think that we're gods or superheroes. We're human. And I can get triggered. The only difference is I have to hold myself and my peace together to not show that. But then I need to go to my colleague, or if you're an intern, my supervisor, or staff it with my director to say, this is what I'm feeling, so we can rely on each other to get tips and techniques and stuff to help us. But there are some people that they should not work with this population, because they will attack you. They will lie. Not just narcissistic, but I'm saying there's some personality disorders that, depending on what's going on, the manipulation, the gaslighting, sometimes they are, I've heard providers say they're a liability, meaning like they won't even see them because they know the risk that they run if these people get upset. I've had one where straight up told me like, oh, if I get mad at business, I just start calling the boards and everybody and report them, because they're not doing what I want them to do. Narcissistic. So that's what I would say about that. For me, it's not a specialty of mine, but I do enjoy working with histrionic. Depending on the borderline, I do with some borderlines. But we're also talking about people that are on medication regimens too. That are at their baseline, I feel like, are easier. There's sometimes no medication for this unless they're dealing with other stuff like anxiety and depression. So I definitely believe different things. It depends on where they are, the level of care. It depends on the provider themselves. And I think that's why evaluation and being able to have a strong clinical team behind you instead of it only being you helps. And maybe they need a higher level of care, whether it's intensive, outpatient, hospitalization, or maybe seeing a clinical psychologist instead of a regular psychotherapist. So you have psychiatry, they do medication. Because a lot of people say, they don't talk to me, they do medication. They're not there to counsel you. Clinical psychologists do testing and actually have a doctorate or an MD, because they're running tests and they're dealing with some things that most people don't. It's a specialty, right? It's kind of like you can be, for an example with that, autism, clinical psychologists are testing for that, not therapists. We can see it, but in order for that to stick and the way that the government and things look at it, psychologists. And then you have a psychotherapist, talk therapy, and we're doing other modalities and techniques, but I just think it depends on the provider. And I don't mean to be long-winded. I'm just trying
I'm enjoying this.
Yeah, just break it down to where it depends on many, many factors. And you have to know as a provider where you're strong at and where you're not, what you're equipped to handle and what you're not. Just because I'm a therapist, and I wish more therapists say this, just because I'm a therapist don't mean I'm equipped to handle everything, because I am not God and I'm not a superhero. I am a vehicle of support for you. You're in the driver's seat. I'm the instructor. If I see that we need to yield right here, I can make a suggestion of what to yield to and hopefully give you some homework to help you or some mindfulness techniques to help you. And I also have to know when I've utilized the skill within me to take you as far as I can and possibly refer you to somebody that can continue the journey with you. So there's a lot of moving parts there that people usually don't talk about.
Do you think that a narcissist or somebody with a personality disorder can manipulate their therapist?
Oh, they would try, but we see it. Now, have they? Probably so. Probably so. I haven't met one yet. Because most people are like, no, I got to refer him or her out. I can't deal with this anymore. Or they develop a great relationship and these people get healing, you know, and their relationships get better and stuff like that. But they will try. They will try. They will. I notice with a lot of narcissists too, they don't have to raise their voice, but they will say certain things to jab and stab at you to get a response out of you. And they will remain cool as a cucumber while they do it. And then ask you, why you getting upset? Why you yelling? I'm not yelling at you. Like, you know why I'm feeling the way I'm feeling.
Right.
But they got you.
Ugh.
They baited you.
You guys do not have an easy job, let me tell you. You do
So
not have an easy job. I was like, I love what y'all do, but I couldn't do it.
Yeah. It is not for the weak.
It is not. You hear that out there, people? It's not for the weak.
So be nice to your therapist.
Yes.
Stop thinking that, well, I'm going over here and nothing is changing. Is it the provider? Maybe they've taken you as far as they can. We've all been to places where we just don't feel a good connection, meaning they just don't have the skill set, the gift in that area. That's okay. Find somebody else. Or is it that you didn't do the work? What is it? Which one is it? Because if and I see this often, you done been through 4 or 5 therapists and nobody helped you, it ain't the therapist. There's a common denominator there and it ain't the therapist.
I love these question and answer series. I learned so much too.
Yes,
So, Miss Keisha, thank you
You're
so
welcome.
much
You're
for
welcome.
answering these questions. And you guys, this is only part 1 of the questions about a narcissist. So definitely stay tuned to our YouTube channel so that you can see more from us.
Yes.
This is Natika and Keisha. We're signing off. Bye.